Good morning and thank you for joining us on Thriving on the Suncoast. You are going to be so glad you tuned in today. Most likely you or a loved one is suffering from shoulder pain, from rotator cuff tears, joint pain from arthritis, knee pain and meniscus tears, instability in your knee from related ACL ligament tears, persistent tendinitis, tennis elbow, low back, nerve and neck pain, back pain from sciatica, from herniated discs, or some other chronic orthopedic complaint. I am really excited about our topic and our guest today. I've really been keeping an eye on this field and have been watching it develop, kind of like laser surgery field, which has developed dramatically and improved over time. My gut tells me I've found the right organization to bring some real relief to your life. Over the past several years, stem cells and PRP, which stands for platelet-rich plasma injection therapies, have become a highly sought-after treatment option as a non-surgical and non-drug alternative for many common orthopedic problems. Since 2005, Regenerex has led the way in advancing this new field of interventional regenerative orthopedics with a fervent commitment to research and publishing much-needed scientific and clinical data. More than 50% of the world's non-surgical orthopedic stem cell literature has been published by Regenerex, and greater than 44,000 Regenerex procedures have been performed. With us today is Dr. James Lieber, a DO. He's the founder and medical director of New Regeneration Orthopedics of Florida. He's a former officer, physician, and educator in the Air Force for 11 years, including as an associate professor of family medicine and osteopathic principles and the practices at Lake Erie College of Osteopathic Medicine right here in Lakewood Ranch. He was a full-time professor there for 5 years. He's also completed his fellowship training in research, teaching, and curriculum development at UNC Chapel Hill, and he's triple board certified in neuromuscular medicine, pain medicine, and family medicine, as well as registered in musculoskeletal sonography. Dr. Lieber specializes in interventional regenerative orthopedics with years of experience, and he's been honored to be the first here in Florida in 2012 offering the nation's most advanced non-surgical stem cell and platelet treatments for injuries and arthritis. Well, that was a mouthful, but very, very impressive. Really excited about this because I think just about everybody you know is suffering from one of these ailments. I don't know what it is, but we seem to be either because we're getting older or I don't think we've learned proper body mechanics that, you know, as we engage in a lot of these physical activities and wear ourselves down and we end up with these chronic problems. Would you say that's an accurate?
Yeah, I mean, it seems like almost everybody has something going on, whether it's an ankle or knee or hip or whatever. Something bothers them, either an old injury or just for unknown reasons starts to develop. Too many birthdays, too much activity and overuse.
So you have this very interesting background. I think integrative medicine has kind of been an area that we've promoted on the show that people really need to take a look at because it looks at the whole body. And how did it lead you into this field?
I mean, that's a good question. I've always been involved in musculoskeletal care in general, but you know, I think, you know, the integrative medicine was kind of an evolution over time, and how to sort of find my own way with that and do my own research on that and so forth. But I've always had a love of musculoskeletal care and orthopedic issues, and so they kind of blend together.
So I remember being fascinated years ago when I first started hearing about prolotherapy, which is an injection of a saline treatment that had some effect. Can you take us through the evolution of some of the different therapies?
Yeah, so I mean, prolotherapy is a concept that started back in the 1930s and is really the grandfather concept to what we're doing today with platelets and stem cells. A couple of famous orthopedists were trying to figure out how to strengthen ligaments that have gotten loose without doing surgery. So they injected various materials, experimenting with that, and found that anything that you inject into a ligament, for example, that is an irritant to that tissue, will cause that tissue to release these things called growth factors, and then the tissue can strengthen itself if done repeatedly. So for many decades, what was used is high concentration of sugar water. That is enough to create that irritation. And the techniques were learned, doctors learned them by doing them blindly, palpating, injecting, and it's still done that way by a lot of people. But we've been able to evolve that, as you said, with better product to inject and better techniques and precision for the injections. And so, and now being able to see the tissue with high-level ultrasound and live X-ray techniques, we can do a lot more than we used to be able to do.
So bring us forward to some of the PRP and
Yep.
the stem cells, which everybody's hearing about, and
Yes.
really probably don't know enough about.
Right. So I think I think it's important to understand how your body normally heals, and that kind of leads us into what we're trying to do here. So let's say you have a cut on your skin. That's the easiest example. The first things that rush to the area are platelets. They stop the bleeding, and that's their first most important job. Then they open up and spill out, again, these things I call growth factors. And there's a whole list of these. And I think the easiest way to explain it is the growth factors are basically phone calls to the subcontractors. They're going to call a plumber, they're going to call a carpenter, and they're all going to come in with the resources to try and rebuild that tissue. And one of the phone calls are the stem cells. Okay? And stem cells are baby cells. They live in high concentration in bone marrow. They live in fat tissue and kind of plastered to blood vessels in different places. When they get the call, they're on ready reserve. They come to the area. Again, the skin is an example. Some of them will turn into skin tissue, and some of them will actually become more like the general contractors of the area. So we're using that person's platelets, growth factors, and stem cells in a very sophisticated way through laboratory techniques to isolate them, concentrate them, learn how they function best, and then under image guidance, safely and precisely put them into tissue that needs it.
Is that the rub there, the fact that they're not concentrated? Obviously, we already have them in our body, so like, why isn't it healing that, that tear or
yeah,
whatever?
I mean, a lot of things get in the way of that. I think how we eat, stress in our life, how we're exercising, medications that we're taking, environmental pollutants, all these things sort of interfere with the way the body heals. But ultimately, as you get older, they don't function as well. And if we can take them, concentrate them, take away the things that get in the way, and then again precisely placing them there's a much higher concentration we can put there, and the body can overcome something that it wasn't able to do on its own.
So what's the difference between where do you use the PRP versus the stem cells, and what types of procedures?
So I mean, they're basically trying to achieve the same thing, so they're along a spectrum. So PRP is not as powerful as stem cells. I think of it as we have 3 layers of treatments that we can do, maybe 4, starting with prolotherapy. That's kind of a low-level treatment. Then PRP would be higher than that, and then stem cells that we're allowed to do within the United States. We have some restrictions, and then above that, something called culture expanded stem cells, where we can grow them.
We got to run to break. Stay with us, find out how stem cells can help you.
The Harvey Center for Integrative Medicine is helping people every day to thrive and live healthy, vital lives. Our integrative approach combines conventional medicine with holistic and innovative therapies to help you achieve optimal function. Are you ready to function at 100% of your ability? Dr. Fred Harvey customizes tools and treatments to achieve optimal wellness at any age.
Hi, I'm Dr. Fred Harvey. Do you want to feel vital, vibrant, and fully energized? If so, call our office to find out how.
When a stroke or injury impacts your life, we're here to help you get it back. With our dedicated team of specialists, personalized treatment plans, the most inventive technologies, and a coordinated approach to recovery. This is more than just rehabilitation. This is a higher level of care.
Welcome back. I'm here with Dr. James Lieber, New Regeneration Orthopedics of Florida. Doc, we were talking about stem cells. It's an area that's, I think, going to mushroom. I think, anytime people can have a less invasive way of healing their body and having their body heal itself, that's what people really want, right? So this is a field that's taking off, and a lot of people are throwing their hat in the ring. You're seeing lots of advertisements out there. Can you kind of give us the lowdown on the good, bad, and the ugly of what we should be looking for?
Yeah, I think it's a really important topic to discuss. I mean, there's a lot of people doing a lot of different things with stem cells. We have certain regulations within the United States that we have to follow. For example, we have to use If we're using bone marrow, for example, to isolate stem cells, we have to use it pretty much within 24 hours. We can't manipulate it or grow it within the United States. Although we used to be able to, the FDA feels if you take these cells and grow them, that they don't think it should be regulated as a body tissue. They think it should be regulated as a drug. And as you know, in this country, it may take $500 million and up to 10 years to get drug approval for that.
Until the pharmacies can control it.
Right, and so we're working on that. We have phase 2 clinical trials on these growth stem cells for disc pain in the back. But it's a long process, and it's one thing indication at a time.
So the purpose of growing would be to have more?
More.
Okay.
Yeah, more, much higher.
More is better.
Plus you could preserve it potentially at your current age, because we know stem cells get worse over time.
And you mentioned bone stem cells. Are there different ways to harvest bone cells? Or,
so
stem cells,
yeah. So bone marrow we feel is the best. There's been more research on it. There's been head-to-head against other areas, and so we feel that bone marrow is by far the best. A lot of people are using fat-derived stem cells. This is a problem. There are lots of stem cells in fat. There's no question about that. But the problem is, in order to isolate the stem cells from the fat, you have to break the fat apart and then isolate it. That component that's in the fat is called SVF. In order to get the SVF, you have to use an external enzyme. Again, the FDA has drawn a line in the sand, said if you do that, you're manipulating the tissue and you need drug approval for it. So there are a lot of people in the United States doing this, but they're doing it, they're doing something risky because the FDA has said that this is not allowed. We don't think it's a good way to go anyway, but that's something that people should be aware of.
I think people always heard of stem cells from, you know, fetuses and stuff like that. I mean, what's the difference there?
So fetal stem cells, umbilical cord stem cells, embryonic, you know, there's amniotic, there's these different things. First of all, we believe, and it's definitely, the reality is that it's safest to use your own stem cells.
Yeah.
Using somebody else's stem cells, there's risks associated with that. Plus with fetal stem cells, aside from the ethical issues that people have with it, is that these stem cells, we don't know how to control them. They can turn into all sorts of things. We use your bone marrow-derived stem cells. We've tracked this over years, published safety papers on this. We've never seen any problems with this at all. So we know it's a safer way to go. What's really hot right now is people using something called amniotic, and I put in quotes, stem cells. So this is what's being advertised. The problem with this, so they get the fluid from around the baby, isolate that, and then they have to package it, and then they sell it to doctors and say, hey, use this to inject. You're going to get a great result with this.
Isn't that the kind of the same thing? It's coming from a foreign person? It's
coming from a foreign. There are stem cells in there. The problem is in the packaging process, the way we understand it is they freeze dry it, they gamma radiate it, basically. So Regenix took that material, took it to their research laboratory, tested what's in them, many different products, and found that none of them have living stem cells in it, despite what the manufacturer says.
Wow.
So we think that it's not fair to call those stem cells.
So who would you say are the best candidates for this type of procedures? Yeah.
Yeah, I mean, I think we see anybody who has pain or instability, and I think at the beginning of the program you listed a lot of the things that we see. We see a lot of people with knee problems. Knees seem to be maybe the most poorly designed body part. So any knee problem seems to respond quite well to this. There are very few knees that we see that we think need to have surgery as their primary choice.
So is it an inflammatory situation typically, or is there, where else was the pain coming from, or what?
Yeah, so it depends. I mean, if they have a ligament damage, then the ligament is torn or a tendon is torn, and we have seen those structures grow back with these procedures. If it's more like arthritis, which is kind of a global disease of the joint, cartilage is wearing away, the joint space is narrowing, there's inflammation. And stem cells don't do a great job at regrowing cartilage, but they do change the environment quite a lot in the joint, so that's a healthier environment, strengthens the underlying bone, will strengthen the tissue, and people, the pain will improve substantially. So for advanced arthritis, it's something we have to stay on top of.
Yeah, because I remember talking to quite a few clients, they say, oh, I'm bone on bone, I'm in a lot of pain, and so it won't necessarily regrow the cartilage, but it will help with the inflammation, which will reduce the pain and make it.
Yeah, it's a tissue
avoid
preservation.
Potentially surgery.
Right. Well, a lot of people seeing us on, I'd say the vast majority of them are people who've been told that their only choice for their knee arthritis is a knee replacement. We don't think that's true. We think there's another choice in between. It's not going to get them a brand new knee, but it is definitely a tissue preservation treatment strategy.
Tell us about a couple of people that, some stories of people that you've worked with, different examples.
You know, I think one that really sticks out of my mind is this woman. She's here in Sarasota, and she's a teacher. And when she turned 50, she decided to lose weight and become an athlete and start running and training for marathons. And she did that, but struggled. She had some knee problems. She ended up getting 2 surgeries for meniscus tears in her knee, and continued to have problems. When I saw her for the first time, she limped in. She's, I think she was close to 60 years old at that point. And her goal, she said, Dr. Lieber, I want to be able to do the Ironman. I said, wow. You know, I don't know if you could do the Ironman anyway. So I said, I think it's likely that we can get you some improvement, and then you can train and see how you do with that. And I was very skeptical. I really didn't think this was a doable thing, because she had bone-on-bone advanced arthritis on the inside of her knee. We did the procedure. She trained for the next 6 to 9 months, and then completed the Ironman. She did great. She had no pain during the procedure.
You're talking like a lot of pounding
the
on the
training
body.
and the actual Ironman itself.
Yeah.
And then
hours and hours.
Periodically, she'll come in for a platelet procedure just to maintain the benefits she got from the stem cell procedure. And she's doing well. So I think she's either done it or about to do the Escape from Alcatraz triathlon in San Francisco. Wow. So, you know, we see those kind of stories.
I mean, that's a really dramatic scenario.
Absolutely.
And so
Absolutely.
people that are just, you know, walking around town are likely to have a much better result potentially.
I mean, what we see, a lot of people who have been active throughout their whole life and who want to remain active and have some sort of injury that's keeping them from playing tennis or golf or some sort of activity that they want to continue. We do see people who are older in their 80s who maybe just want to get to the mailbox or just want to be able to walk a little bit.
Seems like everybody's half of Sarasota's facing hip replacement. Can you address that real quick?
Yeah, hips are the toughest thing that we face. So when someone comes in with a very advanced hip, I'm usually leaning them, when I say hip arthritis, I'm leaning them in the direction of getting a surgery, because those are fairly successful surgeries, even though they come with high risk. Our procedures are hit or miss. We have some great results with hips, and we have some mediocre results with hips.
We have to go to break right now, but check out, we got a little video clip of another client of yours that had some interesting results from this.
Don and I love outdoor activities. I guess we always have. Right now our passion is dancing. What we really like about dancing is 2 people moving together.
2 people moving together to music.
The dynamics are amazing.
It's an amazing thing, almost mystical. And it doesn't always work, but often it does, and when it does, it's just wonderful.
We were both professors, Don, in mathematics and ion statistics. I remember at dance classes doing basic moves like putting weight on the knee, not being able to do that, pushing back, couldn't do that. The knee would lock in place for hours at a time. Basically, there was a chondral flap that was getting caught in the joint.
We call it a flap tear, where a piece of cartilage was loose and getting caught at different times. Additionally, she had pretty significant arthritis in that knee.
When it started locking in place, I think, you know, things were pretty much critical and I had to do something. I knew the conventional option would be a knee replacement. Didn't want to do that at all.
She came to me wanting to see if we can do anything that was non-surgical.
Don and I had read about Dr. Centeno's work years and years ago, and so I just thought to maybe look into the idea of stem cells to see where that had progressed. And I was kind of surprised to find that, you know, RegenX had an entire program, and even more surprised to find that there was a physician locally, 2 hours away, who performed the procedures. That was Dr. Lieber, and we were very happy to find him.
We were able to perform a stem cell procedure on her.
I can do the things I couldn't do before the procedure. I can put weight on the bent knee, I can push back, I can move forward. You know, it's actually very good functionality.
I'd say we've been kayaking for about 15 years.
Rivers where we live are just incredible.
Don came to me with a problem with his shoulder.
It was not getting better with physical therapy.
He was having significant shoulder pain. When we did our evaluation, we found that he had a large rotator cuff tear.
Having seen Marie's success with RegenX, went to see Dr. Lieber and decided to go ahead with the shoulder procedure.
We went ahead and did a stem cell procedure on his right shoulder.
I can do anything in life that I really want to do. I have essentially full range of motion. I really couldn't be more happy with what happened.
Welcome back. I'm here with Dr. James Lieber. We're talking about ways to improve your orthopedic problems without surgery, naturally, letting the body heal itself. Hopefully that video was pretty telling of some amazing success stories, one of many. But on the other hand, you know, it's nice to show a couple of people that have had some great results. How are you reporting your results, and can people really see, you know, the data of, you know, what percentage of people are actually getting well from this?
Yeah, I mean, I think it's crucial for a field like this. This is a new field. There's a lot of misunderstanding. We need to be collecting data, and that's one of the most important things that Regenix is doing, is as a team of professional researchers that's tracking all the patients that get these procedures through affiliates across the country. So we're able to first look at safety. That's very important. And then second, determine who's a good candidate and what are percentage improvements, and we can sit in front of the patient, give them realistic numbers for that. Not everybody's a good candidate, and not everybody should have the procedure, and we need to be honest with everybody and do a good analysis.
Well, you want to have good results.
Yeah, of course.
You mentioned that you have clients coming from all over, because I don't know how many Regenix offices there are, but there aren't that many in this area. I think you're the only one.
Right, so I think they're up to somewhere around 40 in the country now, but we're the only ones in Florida at this time, and we've been here for doing this with that
and people
organization.
Are flying in from various locations.
Yeah, Denmark and England and out of state,
wonder of the internet.
Canada, yeah, everywhere.
So what kind of percent, is there a way to put a percentage on improvement, or different types of procedures have different outcomes?
Yeah, definitely. I mean, it just depends on what their particular issue is. I mean, knees are the easiest thing to explain, because it seems like our improvements are pretty consistent with those. Again, most of the people we see are people who've been told they need a knee replacement. So even in that category, which is severe bone-on-bone or close to that, we're seeing that almost 90 to 95% of the people are reporting some degree of improvement over time, 1 year, 2 years when we track them. And of that, you know, you're going to see a range of improvement from mild to complete improvement. But on average, we're seeing about 55 to 60% improvement in pain and in function. And for that category of person, that's usually pretty meaningful, clinically meaningful.
So people come in and you give them an honest evaluation of where they're at. Tell us a little bit about the process, the collection of stem cells, what's involved, how long does the process take?
I mean, the first thing is they've got to come in and we've got to give them time. We've got to understand their story. They have to have a good evaluation. I'm going to do usually a diagnostic ultrasound of all their tissue and look at that tissue in real time, and then educate. So their appointments are going to be at least an hour long, which is very different than the way I practiced in the past. Once we've determined we're going to go forward with this, it's not like they get the procedure that day or the next day. There's some prep time. Most of the people coming in have had this for a while, so they have a little bit of time where they can prep. And what we're trying to do is, you know, I'm really dependent on that person's stem cells, the function and health of their stem cells, and people vary substantially. So we want to try and optimize every variable we can think of. We know that nutrition makes a difference. We know that certain medications can have negative effects. We know that certain supplements can be beneficial. We know that if you're very active, that your stem cells are going to be more active, and so on. So we have a variety of different things that we're going to discuss and put them on a program in advance. And it's usually about a 6-week window before we get started. Once we get started, the process is usually most stem cell procedures occur over the course of a week. It's 3 different days of treatments. For my schedule, for example, it's a Tuesday, then a Thursday, then a Tuesday of the following week. That makes up the entire stem cell protocol. They're going to have some pain after the procedure. We keep them comfortable during the procedure, but afterwards they're going to have some pain, and we're going to provide them with some pain medicine. It's just going to be a couple of 2-3 days, usually on average. We'll get them into physical therapy. We'll provide them with a protocol and a rehab protocol, and they'll start to see improvement somewhere around 6 weeks, better than that at 3 months, better than that at 6 months, and they'll start to plateau somewhere close to a year with their improvement.
Wow, so it really is a gradual thing over time.
It's a process, right? It's not like
cortisone. It's good to know that it
cortisone.
keeps getting better.
Correct, yeah. Cortisone's the opposite. If you get improvement, it gets good.
I was reading
drops.
a little bit about cortisone, because I think a lot of people kind of use that as, hey, you know, a quick fix to get rid of the pain.
Right.
So can you address how cortisol works and what's the long-term effect of that?
Yeah, I mean, I've given probably thousands of cortisone injections, regrettably, in my career, and I don't do that very often anymore, only in certain situations. We know there's a paper that just came out last week showing that cortisone thins out the cartilage in the joint when you put it in there. It makes things worse. It degenerates the tissue. It's the exact opposite. It'll shut down inflammation, so maybe pain will get better, but what you're doing it's at a cost. It's not only for that joint, it can affect the rest of the body. It can elevate sugar levels. It changes your body's ability to heal anywhere. So we know cortisone is just a bad thing in general for the body, but sometimes it may be the right thing, but not as often as it's being used.
It seems like almost any medication has, you know, a different effect,
right.
a positive and a negative effect, maybe longer term.
It's always a risk-benefit kind of analysis, but I think people are not doing that analysis correctly. I think it's more risk than we realize.
Well, you know, I think as the data comes in, as the knowledge comes in, and the studies come in, you know, people's perceptions of what the best way to go changes.
Right.
So I suspect because you're healing people, insurance doesn't pay for this?
Well, it's an evolving process, right? So we started doing this in 2005. Insurance still considers this to be investigational. That's how they categorize it. Mm-hmm. So people can come in for an evaluation under Medicare is what I accept.
Since 2005, you said?
2005, yeah.
So over 10 years is still investigation?
Correct, yeah. And so what we're doing is, as an organization, we're working with large self-insured companies. Mm-hmm. They make their own decisions for their employees in terms of what gets covered. We have several that have signed on that are covering this for their employees. We're trying to go down that path and get a lot of coverage that way, and then hopefully get coverage through the other major insurers over time.
So you've got some talks coming up. I think it's important for people to get information. Where are some of the ways that they can learn more about this and do? I think people should do their own research.
Yeah, the next one we're doing is June
12th.
12th. Okay,
yeah, I got it.
June 12th.
5 o'clock.
It's going to be 5 o'clock at Lake Erie College of Osteopathic Medicine, LECOM, which is over in Lakewood Ranch on Lakewood Ranch Boulevard.
Right.
Yeah.
Tell us about your websites and what we can find there.
So our website is linked to the overall National Regenexx website. On our website, you'll find a lot of information about me and the procedures and so forth, and then linking to Regenexx website, you'll see outcome data. Everything we do is transparent. We want people to understand what the outcomes are. All the publications that have been published by Regenexx are posted on there. Blog information, lots of discussions that way. It's a pretty robust amount of information. It's important, I think, if people are going to be thinking about this, choosing someone, they should do a lot of research on this and understand what they're getting into. There's a lot of the Wild West stuff happening out here. Not everybody is doing this, I think, the right way. We're not dabblers. This is what we do 100% of the time.
Doctor, thank you for coming on the show. I think this is really important information. It's going to help a lot of people feel better. In the meantime, if you're in pain, you need some help at home, call Comfort Keepers. And when you're ready to get good information, look up Dr. Lieber and his organization. Thanks for watching. We'll see you again next week on Thriving on the Suncoast.
Comfort Keepers, Comfort Keepers, 'cause there's no place quite like home. Call Comfort Keepers.